think the big difference with the KLOwen system is that it's a much more accurate and a much simpler process, and it helps us to get to our finish much quicker in a much more efficient way. But if I were to say it in a phrase, I would say that we are achieving clinical excellence using a digital workflow, the efficiencies of a digital workflow that really essentially allow us to have more time to treat more patients so it offers more our practice growth opportunity. And basically it's freeing up our time to be able to serve more patients. I met Dr. Owen at a Seattle Study Club meeting, and I listened to him speak, and I loved the way he looks at things and making the process as simple as possible, really simplifying the process down. And the digital workflow is not something that's foreign to us at all. In fact, we use a digital workflow with aligners all the time. And so the concept of having a digital workflow for labial appliances is really effective in this with the KLOwen system. And honestly, I'm just really excited to be a part of this, because I feel like it's an evolution. It is definitely an evolution of the profession. And I feel like it's almost on the level of going from tweed appliances to straight wire appliances. It's the first and only customizable 7-to-7 bracket system. I'm very confident that the KLOwen system will really replace the one-size-fits-all bracket system that we've had in the past. And the price point of $400 to get that, it's a great thing. And really the take home is that it's really about the patient, the fewer appointments, shorter treatment time, less discomfort, and a better overall patient experience. I'm really glad you asked that also, because indirect bonding has always been a challenge to a system that hasn't really been perfected. And I think any orthodontists that have been involved in indirect bonding in the past have been frustrated, and so they're probably pretty leery of when that subject comes up. And so I just want to reassure all the practices that are considering using the KLOwen system that this indirect bonding system, this tray, is extremely accurate, and it's user friendly, and it's not like the others that we've used in the past. And so historically, my experience has been, and I think I've used pretty much every indirect bonding system out there, has been that they've either been too soft or too hard. So soft being that when we would put we'd seat the indirect bonding trays, if it's a softer material and you press with too much force, you can displace the brackets too gingival, and so the position is not as accurate as it's displayed in the improver. And so this material that Dr. Owen's come up with it's actually very rigid material, so that when you put it on, when you seat it, you know that it's home. It's like when you thread a knot onto a bolt, you know that it's threading on, it's where it's supposed to be. This is the same thing. So you'll set the tray on, it's rigid, you know it's not going anywhere. You cure the adhesive, and then the cool thing about part of this is that then you heat up the indirect bonding tray either through the patient's body heat, or you can use a tooth dryer, and then it softens the material. So you have the benefit of a rigid indirect bonding tray as well as the softness, so that when you take the indirect bonding tray off, it doesn't pop any brackets off. And so and I guess in a word, it's brilliant, and it's the best I've ever used. And so it's always been the weak link of indirect bonding is the tray. And so with this part, it's almost like making it like McDonald's, where it's consistent, it's easy, the techs know how to use it, and it has a predictable outcome, it's reliable. And we've started over 270 cases, and what we're finding is that we're seeing across the board is a 30% reduction in treatment time or more. And so basically, I feel that part of the success of the KLOwen system is this is one of the key parts to the success of it, is that these indirect bonding trays are so incredibly accurate. We're not currently printing the KLOwen bracket IDB trays in the office, but there are a lot of practitioners that do. And so that means that they'll be able to have, if a patient comes in and they want their braces on that day, they will be able to have their braces on that day. So if they come in at 11, they go to lunch, come back at 12:30, and they can get their braces on. There's no other system out there that a custom bracket system where they can get their braces the same day. And there's nothing even close to it at this point. So that's another really huge benefit of having that, to be able to provide same-day braces. So the slot size of the brackets is different than conventional braces, and I think this is the second thing that really differentiates this bracket system, because typically we finish in, most orthodontists use an 022 slot. So the vertical height of the slot is 022 thousandths of an inch, and the wires that we typically finish in are 0.019 vertical, and so there's up to 40 degrees of play. And so with the KLOwen system, the bracket height is 0.0195 thousandths of an inch, and the height of the wire is 0.019. So we're looking at about 5 degrees of play versus 40. And so the reason that, in my experience in practicing, that we never finished in like a 21, 25 slot or wire size is because sometimes we don't want to express the full prescription of the bracket. Because if we're creating buccal crown torque and we're actually tipping the teeth in an area where we should be, rather than bodily moving them through cortical bone, especially the lower incisors, I was always hesitant to use a full-size wire for that purpose. And so if we are going to use a full size, if we're going to completely fill the slot, then I think it's really prudent that we have something that will give us a projected treatment outcome. And so with the KLOwen system, through the OrthoSelect DIBs, we're able to see where those teeth are going to move, especially the lower incisors. And so we can predictably say what position they need to be in, and then it's okay. I think it's safer than that we can fill the slot completely, because we'll know where those are going. The cool thing about the slot size, then we have the two things. We've got the accuracy of the indirect bonding tray. We have the accuracy or filling the slot, so we can predictably see where those teeth are going. And so when my patients come in and I pull up the DIBs, the OrthoSelect approver, I can show them and I can say, this is almost exactly where your teeth are going to be, and they are. And it's a really cool communication that we can have with the parents, and they look at that like, man, that's amazing. And we can even go through the different time frames of the approver and say, well, this is where you are now, and this is where you'll be at X period of time. And so it's been a really, really beneficial thing, because historically when we use other approvers, like for aligners, for example, we almost always overcorrect in the approver. And so if you looked at the predicted treatment outcome in an aligner approver, it's gonna, the back teeth, for example, may be flared out a lot more, because we have to add additional overcompensation, so it's not going to look like the approver. So this is the first time I've ever seen an approver deliver what it says it's going to do. It's really amazing, and it's a really, really great communication piece, because we try to tell people, well, this is what's happening with the treatment. Like, okay, doc, whatever you say. But if they can see a picture what's happening, it explains this obviously so much better than we can. It's been a really, really valuable tool in communicating with our patients and their parents. When we think about the experience that the assistants are having, we kind of look at maybe even a more holistic approach, which is basically the whole office. So when we look at the front desk, we look at how we're not getting bottlenecks of patients that we can't book within the next 6 weeks, whatever, because it opens up our schedule so much more. And it's such a relief for the front office. Clinically, the assistants, most of my assistants have been with me at least 2 years, and some of them is up to 13 years. And so they're used to seeing progress with our other bracket system at a certain pace. And so when our patients come in and we see them, it's like, for us, it's like, wow. And the assistants have that much experience to say, oh my gosh, that is incredible. And so they're able to share that enthusiasm with the parents and the patients. And again, we can show them the the projected treatment outcome, and it really empowers the assistants, and then for them to see sort of this kind of change because of this cool system that we're using. It really makes them, they feel like they're empowered and they feel like they're really a part of what's happening. And then also from a profitability standpoint, and we look at, historically I've treated patients with 20 plus visits, and now we're down to 10 or less. And so it's just for the price point of $400 to get in for the trays and the IDB tray, or sorry, the IDB tray and the brackets. It's so much more efficient. The profitability is very good. So again, we have over 270 cases going now, and so when our TCs get in with the patients, it's really when we tell them that they're going to have their braces on for a shorter period of time with less appointments, and it doesn't, we don't upcharge for KLOwen, and so the fee's not any different. We've seen a significant increase in conversion rate, and it's really it's a win-win, and the patients see the benefit of it, and it's just like, yeah, just sign me up. It's awesome. The workflow has really changed with the KLO system because we're really starting with the end in mind. And so we'll do the intraoral scan, we send the materials over, we get the setup back, and I tweak the setup and move the teeth where I want them to be. Dr. Del Torre and I do that. And then by having that and having confidence that that's what it's going to look like, it really gives me a lot of confidence, especially having this many cases, and to see the predictability of it. And so when we then put the braces on, we know those IDB trays are seated properly, we're bonded those correctly, then we're like, here we go, and typically after a certain wire size or full size wire that we would use, we'll do a progress panel, and we reposition some brackets. And now we just do a progress panel. We might do a detail appointment, but we don't have to reposition brackets anymore. So we're not backing down wire size. We're not losing time in that process. And then we're able to finish, obviously, again, in shorter treatment time. But the really cool thing about getting that started is, or having that the clarity of what the projected treatment outcome will look like. I'm so confident every time that we do this that that's what it's going to look like. And so it's just, again, it's maybe analogy would be like when you're walking your dog. The dog obviously goes side to side and you're walking straight, but that's kind of how it is with traditional braces. We're just kind of bouncing around the side of the slot trying to find that sweet area where we want to end up in, and there's just a lot of artistic kind of work to it, and this takes that out. And for somebody, for example, that the newer orthodontist coming out, and I've been doing this a long time, and I've learned how to bend the wires and put the first, second, and third order bends in there that are lacking in the system, but it takes a long time to really get that down. And so this completely eliminates the need for that, or almost completely eliminates the need for that. So for newer orthodontists starting out, this is a much easier system to use to get you to a really excellent clinical result.